So welcome to tonight's meeting of the Health, Housing and Adult Scrutiny Committee. So I'm Nigel Long and I'm chair of the committee. Tonight's meeting is being recorded and will be posted on the council's YouTube channel in the next few days. And as it says in my notes, please use your microphones because we can hear you better with your microphone. We're not expecting a fire alarm tonight, so we won't have to rush out. Let's now move to the business of the meeting. Sian, do you have any apologies?
Thank you, Chair. Yes, we've received apologies from Councillor Andrew and Councillor N. Khan. And Councillor Kendrick will be acting as a substitute for Councillor Khan for the duration of the meeting.
Now we need to go around the room and introduce ourselves. So if I start and we go around that way. So I'm Nigel Long, as I say, I'm the chair of the meeting. I'm a councillor for Bletchley Park and perhaps Bletchley Park and Fenny after May. You know, and thanks for the Fenny bit, it's really helpful.
Thank you, Chair. Sian Lloyd, Senior Governance and Scrutiny Officer.
Jenny Ferrand, Vice Chair of the Committee, Councillor for Monkston Ward.
Duncan Banks, member of this committee, and likewise I represent the same ward as Jenny.
Councillor Mariah Priestley, representing CMK Ward, member of this committee.
I'm Vicky Head, I'm the Council's Director of Public Health.
And I'm Maureen Bacard, Deputy Director of Public Health at the Council.
Julia Banham, Team Leader, Strategy and Commissioning and Housing and Regeneration.
Will Rysell, Head Up Housing Delivery and Regen here.
Darren Kendrick, Central Milton Keynes Ward, substituting for Nassim Khan.
Henrietta, representing Cable Park and Wolverhampton. I'm a member of this committee.
Councillor Sue Smith, a member of this committee and representing Wolverhampton and Fishermead.
Tracy Keach, Deputy CEO, Healthwatch Milton Keynes and co-opted member of this committee.
Welcome to everybody tonight. Are there any disclosures of interest? Thanks. Minutes of the last meeting, are they a correct record?
In a couple of paragraphs before the end, there's it's page 10 of the agenda. It's noted at the top that the committee asked to be kept informed when the data from the condition surveys, property condition surveys, had been processed. Bitter experience says that unless we make that as a recommendation, it doesn't happen. So can we convert that to a recommendation? The committee agreed it.
I mean, I'd be fine with that. So what Jenny's asking for is, not strictly speaking, a correction to the minutes, but she's suggesting that to enforce that minute and make it more solid, there ought to be a clear recommendation. I think we're fine with that clear recommendation. Having said that, I also thought that the other issue that was in the minutes was we'd asked the cabinet member to come back on to confirm that the changes we were suggesting on their consultation, that he confirmed that they'd been picked up. Now, I don't know, Sian, whether they have been picked up, but it strikes me that what's kind of missing is a process of seeing whether the minutes are followed through by the people when we ask people. So I think it said the current member of housing be asked to amend the draft strategy. So has he amended the draft strategy? If not, why not? Yeah. That's on page 7 on the minutes. So the point I'm making, as with the point that Jenny made, we maybe need to get, well, the minute in terms of the cabinet members quite clear. I think the other one was a point that we perhaps should have picked up at the time in the minutes. You know, so we need to be, I guess, as a committee, clear about some of our recommendations, and then we need. And then I think we also need a way of checking whether the cabinet members done what we've asked them to or responded to what we've asked them to. I mean, his answer might be, I'm not making any changes. Fair enough. People will draw the conclusions from that. But how do we follow it through? I think that's what I'm saying.
If I may, Chair. So just on that point, when the delegated decision was taken, the Cabinet member did put a commentary in the delegated decision as to the reasons that he didn't take forward all of the committee's suggestions on that matter. But notwithstanding that, I do take the point that it perhaps would be helpful for that to be circulated to the committee so that we can see that, and I can certainly circulate that report by email if that would be helpful.
Do people agree with that? Because it would be helpful to be able to follow up some of the things in the minutes. Just from if you were a charity or you were on a management committee, you would do that, wouldn't you? Or a board or something. We ought to be following up these things. Jenny?
Yeah. Can I just check with the officer? Do we not have the action tracker? We do surely have that for this committee.
So there is a mechanism for tracking the actions. We don't always bring that to the committee on other committees would take that. Other committees do take that as a standing item. So that is something we could look at doing if the committee were wanting to do that, to actively have it at each next meeting. They can look at what progress has been made. That's certainly something we could look at adding into the agenda.
I think it normally comes to the planning group, but of course we didn't have a planning group this time.
So for the purposes of
despite it being minuted that we should have.
Yeah. So for the purposes of tonight's meeting, can we make a note that we would like to be able to follow up on requests to cabinet members, and as Jenny said, it probably should have gone to the chair and vice chair's meeting as part of the process. Okay, let's move on to item 5. I think you're doing this, aren't you, Vicky? It's about older people. I guess I'm falling into that category myself now, I believe. Now I'm retired, which is a bit frightening. But there's an interesting paper. Do you want to take us through it, Becky?
Yeah, thank you. And I'm not going to kind of go through it bit of data point by data point, but I guess we wanted to bring the paper here to share really the evidence of the changes that we know we're expecting to see across Milton Keynes in the future. And I guess we want the committee to be aware of those forecast changes, but also we would then welcome recommendations and views, suggestions for how the council and the city could respond to that. So the information that's shared here is in line with information that we have shared with the ICB, so the NHS are also aware of the sorts of changes we're expecting, and we're planning for those as well. But I guess obviously this is responding to these changes as a kind of long-term project. So as we go, there will be time to develop our ideas and our approaches. Just to summarise the key points from the paper, I think the first thing is to say population ageing is something that is talked about internationally and nationally. It's not unique to Milton Keynes. And that's partly because people are living longer, and also partly because birth rates are falling. So a high proportion of our populations are made up of older people than they used to be. But what the paper outlines is that ageing in Milton Keynes is going to be faster and more pronounced than seen nationally. And that's because of its history as a new town. Milton Keynes has always had an unusually young age structure. But as the city has matured, so have its residents. And we're kind of approaching the point where more residents are starting to reach older age. So at the moment, we still have among the lower proportions of older people in the country. But when we look 10 years ahead, we're going to see a 77% increase in over 85-year-olds. And nationally, that percentage increase is about 46%. So that's that kind of, we're going to go harder and faster in Milton Keynes in the next 10 years than nationally. So in line with that, we are expecting that there will be more older adults who are living alone. There'll be more people locally whose day-to-day activities are limited by illness. Looking at dementia specifically, we're forecasting a 78% increase by 2045. That's from 2,900 residents to 5,200. So just in numerical terms, that's a big chunk more people. And obviously all these changes are going to translate to increased demands on health and social care, as the paper describes. It's worth remembering that obviously most of the people who will grow old in Milton Keynes already live here. So we can look at our kind of older middle-aged population and see what's happening there in terms of their health and well-being. And we can already see the impact of ill health and deprivation there. So around half of people aged 55 to 59 in our most deprived areas already have a long-term health condition. We also know we have slightly higher proportions of older middle-aged people who are private renters than you see nationally, and a slightly higher proportion who claim universal credit. So we might have slightly higher levels of vulnerability financially in the population here that might affect their financial vulnerability in older age as well. So overall, we can expect to see a rapid increase in the number of older people in the city, and in line with that, we can expect increasing demands on health care, social care, and housing. And very happy to answer any more detailed questions and hear thoughts from the committee. Thank you.
Tracy first, and then Mariah.
Thank you. I thought it was a really interesting paper. The first thing that caught my eye was the lovely little map, and I thought that was terribly skewed because of, obviously, when you take a census, you take it where you are. So our really dark 45 to 72%, the hospital's in the middle of that. So that kind of like explains that part. And the kind of red areas have care homes in them as well. So there is a little bit of skewing. But I'm thinking and so I'm kind of glad housing's here today, because sort of some of the issues around our older people and the most deprived and our suffering more ill health, that's partly why they live in the deprived areas. It's partly why the areas are deprived. And so there's something about kind of working with housing. Now, on the one hand, with more people being cared for at home, it's really useful for the carers to have them all in one place. But actually thinking sort of council housing, it might be worth thinking about how do we spread them around so that we don't sort of, because we know that, say, GP practices, etc., in the more deprived areas have less funding and less resources. So how do we spread that around to kind of even things out a little bit overall? I know you don't have the answers, and I don't know if anybody does, but also, and I know you mentioned it, but working really closely with how the neighbourhoods develop and what's available, and making sure that there is some sort of, because the ICB will no longer have the ability to do the groundwork with people. So public health, I think, are going to have to step up, because obviously Healthwatch won't be around to do it. There's not going to be anybody who's available, present company excluded, but to talk to people day to day on the ground, 9 till 5, because everybody here's got their day jobs, and it's quite difficult. Apparently our MPs are supposed to take over a lot of that public engagement. So yeah, I don't know. It was a long rambling, more things to look out for than any suggestions. I'm sorry.
I thought some good points in there. I love the point about the MPs, by the way. So I think what they're saying, from what I can make out, the MPs and their teams of staff are already overwhelmed, 24/7 with emails, answering emails. So whether they're going to do other things as well and fill the vacuum. I think we all probably think it's a barking decision what's happening to Healthwatch, but it's happened before, absolutely barking, and somebody will say, oh, I've got an idea, let's, But anyway, who else would like to come in next? Well, I'm sorry, I got you down, Mara, on my list. Thank you.
Vicky, that obviously there's been a bit of analysis around, well, I guess it used to be called comorbidity, but now because of the prevailing circumstances, it's a range of illnesses all combined. And I know that you've talked specifically about dementia because there is a marked focus on that in terms of what prevails in terms of presentation. My question really is around the dementia aspect in terms of early screening, if I can use that terminology, and trying to support families to screen or get support around diagnosis. I think that's what I wanted to say. What is the plan? Because as we obviously increase, as you said, in the next sort of 10 years, that by sort of calculations, the prevalence of that will increase, and therefore we would need more resource around that area. Any thoughts about how we're handling that as an area?
I mean, so primarily that will sit with the ICB, but broadly, I completely agree with your point around the importance of early diagnosis of dementia for families, and then access to support, which can now include pharmaceutical support, so medications. So the evidence base for that is it's not the best, but yeah, we will need to be able to provide that early diagnosis for a growing older population. So the ICB will need to be thinking about how it can do that. I guess I would acknowledge that quite a lot of progress has been made and improvements have been made to our early diagnosis of dementia rates across the ICB area. So hopefully there is a good platform there that can be built on.
Can I just, before I bring Duncan in, can I just pick up on that point as well? Because it strikes me that in my conversations I've had with Victoria, she said, I've always been very much against care homes. I'm not a great fan of care homes, loss of empowerment, loss of independence. But Victoria tells me that virtually everybody who we put in care homes has got dementia. So is there a debate around how we help people manage dementia in their own homes? Really, care homes is the very, very last alternative, or are we at that point already?
I think Victoria would have a much better answer to that than I would. I mean, I think, what we want to do is prevent people getting dementia, and remembering that some of the best ways to do that are actually about all the things we know are good for us in life generally. So healthy diet, exercise, not smoking, etc. And then once we, inevitably people will continue to get dementia, and then we do need to support them and their carers and families so that they can remain independent for as long as possible. But I suppose recognizing the reality of dementia for people and for families, I think it's hard to foresee a world where we don't still need people to be being supported in care homes. So I think it's about doing all the things, if that makes sense. Yeah, but Victoria would be a better place to answer.
I've got Duncan.
Yeah, thank you very much, Chair. My question is very much very similar to Councillor Priestley's question. And looking through your report, I see that where you've got the figure 2, that's a snapshot of 2021. And that information not going to be easily available again for quite some time because it's a census. And I also see that you've relied on the LGA Adult Social Care Use of Resources Narrative Report. That's 24-25. I'm just wondering, I don't think the ICB will have the ability to obtain the sort of information that you want to look at the increase in dementia, for example, in the population, because they're cutting back on that. And also the government's cutting back on Health Watch. It seems to be the only way we're going to get this information is to start talking to the GPs. They don't have to share information about individual patients. It's just, do you have the information about the percentage of patients with these following conditions, long-term conditions, type 2 diabetes, and dementia, and then maybe the stage of dementia. And I think that sort of information could be available. I think we just need to try and find a way of obtaining it.
I guess just to pick up on that point, just to reassure you, we are in a much better place than we used to be around healthcare data. So actually GP data feeds into a great big repository of healthcare data, and it links to hospital records. So we can now get a much better sense of the health status of all of our residents, and that would include dementia. I guess there can be challenges along the way around how things are recorded, but broadly we are able to see much better than we used to what's happening in our registered patients in the area.
Can I follow that up? Yeah, you say in the report that the information is the data reflect people who live in MK and are registered with a GP in BLMK, but that information must surely have come through the ICB route.
Yes, it all flows in to the ICB, but then partners have access to that in controlled ways. So within public health, we have analysts who are able to access that anonymized patient level data. Yeah. So we are working quite well as a system on that, I would say.
So I'm going to take Jenny next, then me, then Ansar.
Okay, a paired couple of questions first. Will the proportion of families of elderly people with local support increase or decrease over the next 10 years? Because my impression is that the reason why we've got such a big increase is partly because these are now people who've spent their whole adult life here and their children are here. So they're staying here, but that actually means a greater proportion of them have family support than had in the past. Now, the paired question is, how much more efficient is it to give the support and the healthcare to, for instance, 10 residents in a sheltered housing complex than it is to residents scattered all around the estate? Should we actually be trying to minimise our support costs by encouraging more sheltered housing and more residents to move into sheltered housing?
Can I just add to that, or should sheltered housing be the base for services that support people in the wider community?
So I think those are two really good questions. The question about whether our older people in the future are going to have higher or lower support needs is kind of the heart of the issue, really. And I think it's quite difficult to have a definitive answer on that. And I think there are some things that mean we think our population might have higher needs in the future. So the things around having more private renters, more universal credit claimants, and so forth. But I think your point is also really good, that actually if we now have older people who have family here, then actually there might be more family support. So I honestly think that there are things we just don't know how how that will kind of net out. But I think it will be, and I think it's really interesting to think about that. So I think it's a really good point. Your other point was about whether it's actually more cost effective to support people together rather than in their own homes. And again, you really need someone like Victoria to help you with that more. My understanding generally is that keeping people in their own homes is basically always going to be cost effective, just because the costs of staff for things are so significant. But again, I think Victoria would be able to help more.
Right. Can I just put a couple of points in, and then after me it's Ansar, and then back to Jenny, and then Mariah. I was surprised that there wasn't reference to the impact of disability as the population ages. I mean, we know that the number of people who are disabled as they age goes up dramatically. Unless I missed it, Jenny. So that was my first point. My second point was that when you read the State of Aging Report 2025 produced by the Centre for Aging Better, its top priority issues are healthcare access, social inclusion and sustainability of services, by which it talks about how support services that communities have are being eroded, and that puts further pressure back on public services. So there are a couple of things that are not covered in this report that I think other bodies would say should be looked at. And as a disabled person, I'm obviously pretty keen on the recognition of disability and ageing. So just make those couple of comments. And what's a really good report,
So I hope the paper does comment a bit on disability, but I accept it might not do so quite as sort of clearly as you might like. But that is totally interwoven with everything that it's getting at, I think. Those Centre for Ageing Better priority areas seem good, and I think I suppose it's partly for us to think about how those priority areas might look for us in MK going forward, and how can we bolster those things.
Just make a slightly different point in response to one of your earlier points before I bring Ansar in. I suspect that we'll rely much more on our daughters than on our sons in terms of family support. I just suspect, not that I'm knocking blokes, but I suspect. Ansar, you're next.
Thank you, Chair. Right, I'll start with my recent appointment as Older Boards Champion, and we had a forum at the Lovat Fields recently, so it was very well attended. So in terms of a lot of the discussion that's happening here now today, we've had people who've attended raise questions about the future transport, how well they'll be integrated into the health system, digital inclusion, housing and all that. I mean, in a broader sense, I know a lot of colleagues have touched upon individual kind of perspectives. Going forward, making that my base, really, what I want to express is it's good that we're having this conversation. Obviously, it's a complex piece of work, and there'll be a huge shift and change in where we are now with the aging population and what can be expected from that. But I gather there would be some age-friendly strategy taking place where all of these and much more that would be included in how we drive this forward and how services will be delivered. And I gather there'll be some modelling work being done on that in comparison to what other cities which have more larger aging population currently, how we would actually look at that and what would work in Milton Keynes. And the real question is that is there any work going kind of forward planned, and how are we going to deliver that in that sense? That's my question. It's a very broad coverage of everything that's been said, and what I've experienced in the forum and the questions that are coming. We'll be feeding a lot of it back to the council from the results of that of the forum. So you can kind of shed some light on that, please.
So you mentioned an age-friendly strategy, and I think maybe that might mean the dementia-friendly work that's happening. So I'm not familiar with the detail of that, but there will be others who'll be able to say more about that. But I think broadly at this stage, this is something that will affect all sorts of areas of our council and our city life, and so we're at the point of really being interested to hear views, I suppose, on the best ways to help the city navigate it, I suppose. So if there are broader views from other forums, then it would be great to get those fed in.
Can I just build on what Ansar said before I bring Jenny in? I mean, I was due to go to that event that you just described, and it's a pity I had to miss it, because I think it was well organised and organised in part by the Disabled People's Organisation. But in terms of what council should do, just building on the Ageing Better report talks about older people's strategy, which I think we have. Older disabled people's strategy, accessible homes programme, which is a huge issue in this city. I think the figure nationally is 93% of homes are not accessible. I think that's a national figure. The AIDS and Adaptations Programme, Older Persons Champion, which Ansar touched on. The Effective Hospital Discharge Service, which Milton Keynes has had a good record on actually for a long time compared to many councils. And then there's an issue about high quality, affordable home care schemes, Then effective coordination between social care and health, which I think we'd argue we have. So what the aging better report does is it suggests a whole series of things that we perhaps ought to be looking at as a council, all of which seem quite reasonable to me. But anyway, Jenny.
Yeah. I'll just make a few comments on things that have been said so far. On the adaptable homes, we did make a change in the previous local plan, which meant that far more homes are being built with either adaptable, either already adapted or able to be adapted now. We're not getting the problem that we used to have of somebody in a flat that they say, sorry, we just cannot adapt this. So that is at least improving. On the dementia question, I would say it's very different for somebody who's got family support and somebody who hasn't. If somebody is living on their own, they are desperately vulnerable if they've got dementia, because they're vulnerable to doorstep scams, they're vulnerable to online alarms, and they're vulnerable to a massive range of accidents that, yes, you can install some electronic monitoring, but you're not going to catch them all, and so on. And they get absolutely terrified. I know this from a friend who had dementia. She was desperately relieved to get herself into a home where there would be people around and looking after her the whole time. It made a huge difference, and she perked up and was then able to cope much better. For somebody living on their own, dementia is very, very scary. I'd ask a practical question. I sent through a question. I don't know whether you're able to supply any information about what the causes are for falls and what the main causes are, because obviously there could be some other implications for the council on that. I don't know if you're able to give me an off-the-cuff answer.
Thank you. It was really helpful you sent that through ahead of time, and we were just able to prep up a bit on it. So we don't have local data on what causes falls specifically in Milton Keynes, but we know what the kind of broader national and international picture is. And I think, so what we know really about falls is that they're multifactorial. So we mean there's no single thing that's important. But what's important is as much about individual susceptibility to falls as it is about hazards in
the healthcare things, the health reasons that make them.
So things that make people vulnerable are particular health conditions, people being on particular medications, vision issues, just purely lack of physical robustness. So being physically active can be really protective for falls. And some of the most effective interventions can be those that are about getting people to be more active and build their muscle strength and improve their gait. So that's kind of super important. But then in terms of where people fall, so we know that actually most falls, so about 3/4 of falls, are inside the home. And then of the rest, sort of about half are out and about and half are in the garden. But so thinking about hazards in the home is probably actually the most important next thing. And things like having, just simply having stairs in properties is a risk for people. But I think, it's helpful to think with falls about how we can build individual people's resilience physically so that they are less likely to fall. That's really important.
It's a really interesting debate, the whole falls agenda, and I thank Jenny for picking that up. I'm going to make a suggestion on recommendations. But my wife had a fall a couple of weeks ago. I wasn't home, and so she was on the floor in the kitchen for quite a few hours. The result of that is that we've now joined the community alarm service. So Beth, my wife, and I have this watch thing, which I'm not wearing tonight, but she wears all the time. And something as simple as that is such a good measure, because if she had have had that on when she fell, she could have pressed it, and it's a really, really good service, and they would have sorted it out. But people being stuck on the floor for hours. I know of other examples, but it's a really big issue for us, really big issue, Jenny. So, wanted to come in, Tracy.
So just on that falls and actually on the alarm, it's really important. So we've been involved in the discharge hub and reviewing that. And because Age UK, for example, they pick up a lot of the kind of pathway one sort of help getting home, they tend to promote their own alarm system. Now that's answered in Edinburgh somewhere, and it's immediately a call to the ambulance. And then you will probably know that if you're on the ground and it's more than 40 minutes, it's automatically a trip to hospital. over a certain age, I think it's over 60, it's automatically a trip to hospital. And then once you get into hospital, you don't get out that easily. And so the Milton Keynes alarm service, and I think the last time we raised it here, Healthwatch raised it here, they ended up making some lovely postcards, which we have spread far and wide because it is a cheaper service. It's local. They will come. They've got the chairs to lift people up. They've got the Whizzan boxes to give they're amazing. But just one question, sorry, am I butting in on Jenny or? Oh.
It's all right. It's all right. You've gone slightly out of the order, but I'll go back to Mariah in a minute.
I'm happy to come in after you. It was just, as we were talking, I thought about one of our volunteers who has a disability. She's in a wheelchair, and she is very dependent on her family for care. And her mum now has heart disease. Her dad has got something going on, we're not quite sure. And, they're aging. So while people have got family support now, what we've got is a lot of adult carers now who are they're cared for is going to need help as they get older, just because they're carers. So we're going to end up with like a little bit of an explosion with some of our, especially with some of our, maybe our neurodiverse, the more kind of, I don't even know how to say, like the very autistic, people that are far more affected by autism, who are not going to be able to necessarily live on their own once their families go. And I just wonder, is that sort of taken into account with these figures?
This is not specifically taken into account in these figures, but I think it's a good point. And I think a learning disability would be another example in there where, as the population is aging overall, we will start to lose those carers that are supporting some of our, who will then be kind of middle-aged residents with disabilities. So yeah, I can see that could have an impact too. It's good.
I've got Mariah and then Jenny.
Okay, thank you, Chair. One of the key things that I certainly wanted to highlight, and I know, you're sort of looking at things from the sort of statistic and data point of view, but I'm saying it as a record for, Victoria and others involved in social care. I found, because very much like Nigel and others around the room, I was a carer for several years for my mum who passed of dementia last year. And one of the things I did notice was when she was progressing through the stages from, I guess, early to late, there was some conversation about putting her in sheltered accommodation. And when she was in that state, in that particular stage, there were issues around, I think, tenancy agreements and the availability of, I think, having her be the actual tenant of where she was supposed to stay as a result, as opposed to myself taking responsibility for that. And the reason I'm raising this is because I was part of a dementia carers group where I would say about tens of people had the similar issue where they did have the option to put their loved one in a sheltered accommodation. But because of the issue of tenancy, it became an issue right up onto the point where their health deteriorated and they could no longer stay in a care home. So I guess my point or question is, what can social care do or housing do in that respect to support people who have this situation? Because actually that could mean, from the council's point of view, saving money, and actually that could mean from the person's point of view, a better quality of life. Yeah.
Could I just comment on what you just said, Mariah? Because I think there's a really interesting issue here, which is, I'm celebrating my 50th year as a disabled person, but I've been fixated for probably 30 years about getting a bungalow when I was older. So I was absolutely fixated on getting a bungalow. But the point is, myself and my wife had pretty good incomes and we could afford to buy a really nice big bungalow. but many people can't afford to buy that accommodation. And so there's a debate about the council's housing role in terms of delivering more and more bungalows for people, you know, or flat access. Yes, you know, there's a real debate there about accessibility and about long-term needs. I suspect a lot of people who are comfortably off, as I say, myself and my wife are, could buy a place, but lots of people are not comfortably off, you know, and it's a really big issue you raise, that housing one. What's the role of sheltered housing? Has it got a wider role? I mean, I was on a ministerial group, 10 years ago, chaired by, God, what's his name? Can't remember what his name was now, chaired by the minister. And the report that came out of that, which I wrote, was about how sheltered housing could be a much bigger resource in the community, and not just, you see, you might base other teams there and they work out of the community. So you get both the supporting people in their own home, but you also get sheltered housing as a facility that allows people to live much more independently. There's some really interesting stuff that's, I think, coming out of the discussion tonight, and it's part of the wider debate. I've got Jenny.
Yeah, I just wanted to come
Yeah.
further point. Somebody raised the question of neighbourhoods becoming sick neighbourhoods effectively, or neighbourhoods with a high concentration of sick people. We need to be very aware that as we tighten our housing eligibility, council house estates are going to be more and more concentrated with people who are frail, ill, disabled, whatever. And that means that neighbour support is going to be much more reduced, because there just aren't going to be the fit and able people to help. The last lot of eligibility criteria really did narrow down the field quite a lot, and we are going to seriously find that. And that's not just in council housing, it's also in the areas where we've got housing association, large amounts of housing, because they're now working to the same criteria. So that issue is going to get much, much bigger over the next 10 years.
I mean, that's really good. But I've got Sue wants to just talk on the housing bit, and then I'm going to go to Nana. Sue.
Sorry. Are mostly all bungalows anyway, so there's a high concentration of sick and elderly people there. But the bit that I liked what you said right at the very beginning about housing becoming involved, Will, that they need their support networks around them. So when people try to move near their loved ones or family or something, we should be supporting the carers a lot. As a past carer, I felt very isolated and not really thought about with the help I was giving to my husband. And you're saying that it's more economical to keep people in their houses than put them into a care home. Then we need to support the carers more than we do now, because as Woughton, we've got the highest number of young carers. So we need to look after our carers because they're saving a lot of money.
I think Will's
recent social services report said that we were doing that. Right. The carers are very positive.
I think you're butting in here, Jenny. I think you're butting in. I was just going to say, Will would probably say, give me £200 million a year capital programme and we could deliver a lot about that. But sorry, Nana, want to come in?
Thanks, Chair. So when I read it, I just thought, great report. I thought it paints a clear picture for me of what is happening in the community. My recommendation is that my idea is that we find a way to communicate these facts and numbers to residents, because it's a repository of information and it's quite passive. So it will do nothing really, except that we know it. So my suggestion or thought was, how do we inform people so that they can take relevant mitigating action before they get to that point, for their health, for their well-being, for their future, so that the information is just not passive, and we're not just waiting for this to happen and they're not waiting for it to happen, but some kind of way of where Milton Keynes really is informed about this is what's coming up the road, and what do you do, say in your 30s, your 40s, before you get to this point, or 55, before you get, how do we communicate this information, basically, so that everybody is actively doing something about it.
Actually, that's a really helpful suggestion and ties in with what I was going to suggest as my third point. What I think we've got from the discussion tonight, and I've enjoyed the discussion, and I think it's a really big issue, not just for the city, but I think for the city council in terms of how it responds to developing services and support. So basically, we do need the recommendations tonight are that we note the rapid changes. I suppose they're not that rapid. That we've known for some time this demographic change is going to deliver what it's delivering. So the first point is note the rapid changes. The second point, I think, is we highlight some of the points that we've considered here tonight. How do you make independence work? What's the balance between sheltered housing and wider community support? What's the balance between who goes into residential care and independent living? I think we've picked up all those points. And then the other point, which Nana's just made, and I think I was heading towards, which is it would be useful if each year the council published an annual Ageing Better report for Milton Keynes. So the Milton Keynes Ageing Better report, nicking it from the Centre for Ageing Better, their idea, and actually produced each year. The cabinet member could lead on that, and I think it would then cover all the sort of information so that we can share with the wider community the challenges that an ageing society has. Have I missed anything? Anybody else want to? Jenny?
Not sure whether you've included as a recommendation this advice for residents about early prevention of later problems. I think that's really important.
Yeah, I think the answer is not specific.
Of course, being simply get out of your car. But the more times we say it, the better. And I think we do need to put on record that the council needs to think about the effect of its more restrictive housing policy on the concentration of frail and disabled and ill people in an area where there is high social housing.
So I think your first points are gone.
Support that.
I think your first points are gone, and I'm going to welcome in. But the problem with your second point is if you have a housing allocation system that gives priority to housing needs, you by definition do that. You by definition. Hold a second. No, Jenny. Let me finish when I'm speaking. The problem is, increasingly, housing allocation policies concentrating on people with greater and greater needs, by definition, will create a housing provision where the priority is always people with greater needs. That's just inevitable, isn't it? But I think, Will, you want to come in on the issue?
Only briefly to say, I think something that potentially, I don't know if it's fair to say was missed or not, but obviously public health, etc., is working with housing, is working with planning on it, and the accessible homes, I agree with. We're seeing an increase in the number of fully accessible M43 that would come through the local plan. We're trying to bring forward more on it. So I think it is recognised. I think that's fair to say. I agree with the housing needs, but it's that ever-growing need, isn't it? And yes, I agree with Councillor on what he said. If you want to give me the money to build, great. We are bringing 4 bungalows forward, which is a start. We've not done bungalows for years, actually, but there's 4 coming in on the former Critch Lodge site as well, which has just started on site as well.
You did 5 bungalows on the Saints estate within the last, about 6 years ago, wasn't it?
We've done some. We did some on Rowlands Close.
Yeah, I did Rowlands Close recently. That was only 2 though.
That's more money, isn't it?
Yeah. It's nice in my ward. Jenny.
Well, firstly, I'd like to come back on what I said before, that we still need to flag up the implications for supporting neighbourhoods of the fact that we are going to get concentrations of people in heavy health need in the high social housing areas. And it's not just council housing, it is also the housing association housing, because the policy is the same for all now. The second thing I would say is that we also need to stress the importance of making completely flat access flats disabled accessible, because realistically, as we get more and more built up, the scope for bungalows is going to get very, very small indeed. And most of our elderly people are going to end up in ground floor flats. And there's no reason why that can't be absolutely fine, providing they're built accessible. But they there can be less scope for adapting them if they're not built accessible to start with. But I know the local plan has proposed a much higher proportion for the future plan than it has for the past as a result of the A2 statistics. So that is in hand.
On your second point, see, I think you're right on the second point. We need to make sure that houses and properties, particularly new build, is accessible. And I think we agree with that. I think you're not right on the other point. You see, the answer to the concentrations of people with high housing needs is to build more council and social housing.
We don't have the scope to do that. We do have the scope to recommend that we improve support.
I'm sorry, I'm struggling to understand. I'm sorry, Jenny, I'm struggling to understand what you're saying. Do you want to just repeat it again?
Sorry, the law is very, very constrained as to how much council and social housing we can get by the financial legal limits on us. So we do not have the option of massively increasing our council housing and social housing programme. We do have an urgent need to prepare for the increase in support needed for those neighbourhoods. They are existing neighbourhoods. People don't want to be moved out and spread apart who are in those neighbourhoods. They are going to need a lot more support.
Isn't that self-evident? Isn't that just self-evident? You know, yeah, I'm fine to know. Just on the social or council housing thing, the fact that this city has only delivered 2% social housing this year is an absolute disgrace. It's an absolute disgrace, and it's a problem for the future. And you're right, the system of funding council housing and the system of funding social housing is dreadful. It's absolutely dreadful. You will not deliver it, you're right, through the planning system. It doesn't work. All the reports from Parliament show it doesn't work. We're all deluding ourselves. I mean, I thought Angela Rayner got it wrong from day one when they talked about using the planning system, you know, and that's why I think there was some shift towards greater subsidy. But unless we get our head round the building of huge numbers of council and social housing, I mean, I put it this way. You've read some of the stuff I published nationally. Rather than spend 50 billion quid over the next 4 years on housing benefit to subsidise high rents in the private sector, stop subsidising high bloody rents, put it into subsidising council housing. That's the way to do it. And that's the way they did it until Mrs. Thatcher in 1979. That's why they built 147,000 houses, council houses a year from 1945 to 1979. And then some idiotic government came in and it's created today's problems. But, you know, maybe we shouldn't be. I think even the Conservatives. Anyway, can I just check with our scorer whether you've got those points that Jenny's made?
Thank you, Chair. So I'll just run through what I've
Yes,
got
please
written
do.
down. So obviously we've got the recommendations as they are in the report. So to note the rapid changes. Then we have the committee's comments in relation to the balance between making independent living work and where sheltered housing could be a better alternative and offer a wider support to the community. We had your recommendation, Chair, that the Cabinet member consider publishing an Ageing Better report, specifically for Milton Keynes. And we had the recommendation about ensuring that advice is given to residents on possible methods of early intervention to avoid long-term and long-standing issues. And then we had Councillor Ferran's point about the importance of supporting neighbourhoods, particularly in areas with higher concentrations of older people or people with long-term health conditions. And I think that captures everything.
Is everybody happy with that? Are you happy with that, Jenny? Excellent. Okay, so do we agree with those recommendations? Thank you. Excellent. Let's go on to the issue of shared ownership, where I do have some real disagreements. Will, over to you, sir.
With a report or in general? So obviously, similar to Vicky earlier, I'm assuming people have read the report. What we've tried to do is give an overview of shared ownership in Milton Keynes. Often brings strong views. I hope shared ownership does. Kind of what I think is missing, what's being proposed in the local plan as well moving forward, which is a slight increase. But the report will also show, obviously, Milton Keynes itself, as a city council, is a bit of an outlier in the shared ownership that it has. We've also tried to kind of include other options of low cost home ownership, because it's not only about shared ownership as well, but that's predominantly what we have most of, and I think nationally what there is most of. Obviously, the NPPF has brought forward other kind of definitions of low cost housing over the years. Different things have been tried. Shared ownership tends to be the one that's stuck all the way through, I think is probably fair to say. So that, in a nutshell, is what there is. We work with RPs and to bring forward the shared ownership. We've not really brought any as a local council forward ourselves. We've got a higher level of need for rented properties on the housing register that we've touched on earlier. Appreciate some of the conversation. Actually, I think it's quite good how it links in actually from a health perspective as well. And what we've also tried to do is, you'll see from the table in there, the size of units that we've got in shared ownership. And I think the final point I'd probably mention is the changes that have been brought in recently, and from a personal perspective, I think is good from the Homes England lease effectively. So we'd always found that shared owners, obviously, as soon as they'd purchased a property and rented, were then responsible for all the repairs and maintenance themselves. That's changed more recently for the first 10 years, which I think is a positive step for shared ownership. Alongside those wanting to staircase up, but the fees are being reduced as well. Each time they wanted to purchase different shares, you had all the administration fees, which kind of been reduced as well accordingly, which I think is a step forward as well. But I think Julia's fed into this alongside me quite a lot. We're open to take kind of listen to debate, take questions on it, answer where we can do. I think if that's okay with people.
Should I just make a couple of comments to begin with, then other people? In March 2024, the Housing and Communities Select Committee said shared ownership schemes are drastically failing to deliver an affordable route to home ownership for too many people and subject buyers to rising rents, uncapped service charges, and disproportionate exposure to rent and maintenance cost, which I think is the point you just tried to pick up in terms of the change. And the Housing Ombudsman last year highlighted the massive increase to complaints around shared ownership. I'm not clear that investing in shared ownership is a good investment, and if I had 10 million to spend on new houses, I'd spend it on new council houses or maybe new social housing with a registered provider. So I'm not convinced about shared ownership, but I could be wrong, and I especially could be wrong considering my first step on the home ownership ladder was a shared ownership property in Oldbrook, which was quite nice, apart from the stairs up to it, but it was a good buy. So I'm not convinced about shared ownership, but other people in the room might think it's an option. Anybody else like to come in? I should have said thank you for the report, though. I do apologise for not saying that because it's quite an interesting report. Tracy.
Thank you. Just to clear my absolute bias here, I think shared ownership is horrendous. It's not something that I've seen until I came to the UK. It's not something we have in New Zealand. And it is just knowing people that are in shared ownership and how much they're having to pay and for the repairs for, especially when they're in housing where their unit may be shared ownership, but the other units in buildings are not, and something goes wrong, it just creates all sorts of issues. So I'm absolutely dead against shared ownership. That's just my thing. But I was also wondering, you talk about the rent to buy and the shared ownership and the first home and blah, blah, blah. How many of the buy to rent do we have in Milton Keynes? Because that is pushing the pricing up. Well, that's what.
I was going to say my understanding is very few actually on the buy to rent. I think it's expensive, it can be expensive, it's difficult to monitor as well. And actually, are people ready to buy after the rental period, I think is the challenge as well.
I mean, it's actually something we've never really taken off in Milton Keynes because it wasn't an affordable product. So it wasn't in previous plans for a very long time. And then very recently, probably about 4 or 5 years ago, we did a trial of only 7 properties, and they're not really working. I think it's safe to say.
Where you buy the houses, the big apartment block across from Escape, that people buy it to be landlords. You're not allowed to live in there, you have to rent it out. So it's buy to rent, not rent to buy. So that's what I was asking, because that's pushing the rental prices up horrendously.
That wouldn't be classed as an affordable housing tenure.
No.
So it wouldn't be, it's not an affordable housing tenure. So it wouldn't.
So Milton Keynes Council planning housing don't have any say in what developers do with their properties. That's my question is.
Sure. No, we wouldn't.
Yeah.
Jenny.
I'll say the reason why we're an outlier is because somebody made a mistake in the local plan quite a long time ago. And for a bit, we were doing 20% shared ownership and 5% social, whereas it should have been the other way round, which is why we have so many of that age that are shared ownership. I'm interested in what you're saying about the service charges. We also, of course, get hellish arguments about social housing people in, housing association rented tenants about service charges. Are they paying more service charge than they would as a rented tenant? Or do they go on paying it longer than they would as a rented tenant? Or if they were buying the service, do they not still pay the service charge? I think this is a red herring because I think they pay it anyway.
Service charges they would pay. It would be the service charge on the block. So it depends what facilities are being charged. For instance, if there's a lift, you're likely to have a higher service charge. If there's cleaning, you're likely to have the service charge. But it would be the same. But it wouldn't end. Yeah. It wouldn't end. They would still be liable for service charge for however long they're in there.
Yeah, so what I'm saying is no matter how much they complain, actually that is a feature of the housing association owning the block. It doesn't matter what tenure it is, it's not to do with shared ownership.
No, not at all.
Yeah, okay. You've talked about the fact that some of the other fees are now reducing. That's very good. I've always said that as far as possible, public areas should be passed over to the council for adoption and that sort of thing, so that massively reduces the service charge. I absolutely agree we should not be doing shared ownership on blocks of flats because that becomes an absolute utter legal nightmare. But for general independent houses, it has worked quite well for a lot of people in Milton Keynes, and it gives them a route out of being dependent on social housing. And it also means that our money goes further. We get more affordable houses for the money. So that personally, I would say we've seen it work very well, providing the leases are right so that we don't get premiums charged. They can't sell them to somebody who funds the mortgage for a week and then buys it off them for private landlords, as happened in the early days, etc. And I think, but also, if we're going back into shared ownership, we need to be thinking about the criteria, the eligibility criteria, and the council needs to have a policy about that, which we don't, I think, at the moment, because we haven't done any for so long. But we need to have a policy that will then apply to the housing associations as well. I do think we ought to be considering also the Rent Plus option, which is a different model where you rent for 5 years and then you have the option of buying and your deposit is paid, because that frees up all those people who are paying more than they would pay as a mortgage in private rent, but can't save because they're paying such high rents, can't save for a deposit. So they can't get out of that bind. That would also hopefully help let the pressure down in the private rental market a bit, because they wouldn't be able to charge quite so much rent. So that I would like to see us do a much better study on that. But all of those are for people at the upper end of our affordable housing group, because as you say, the vast majority can't afford any of that and desperately need seriously subsidised rent. And I absolutely agree. There is not a lot of solution other than the government putting more money in.
I think you're right about that. I've got Mariah. Oh, sorry, go on.
Sorry, and Julian, you just made a really good point, actually. The question about the service charges earlier. So yes, they're still liable, but just for clarity, obviously, if it's an affordable rent, that's inclusive of the service charge. So you may not see it separately. If it's
Say again?
If it's an affordable rent tenure, that's inclusive of the service charge. So you wouldn't see a separate service charge. If it's a social rent, the service charge is on top. So just a clarity, it's still charged, but affordable rent is 80% of the market inclusive of service charge.
Okay, so
Go on, Jenny.
do affordable rent tenants not have the same rights to know what is comprised their service charge then as everybody else does? And somewhere you were talking about no accountability. Is there any way we can put policy in or whatever to say that tenants must have a say on the management of the service charge issue?
So they would have the right to know their service charge, whether it's an RP, whether it's the council. It's included, yet they have to, when the rents are calculated, they would have that. So everyone would have the right to do it. And from memory, if there's changes to the service charge, there would be a consultation on that for those that are impacted. So we certainly would, RP certainly would. But the other thing to take into account, less with the council, because also I should say we're not proposing bringing forward any at the moment. I think that's clear. We've got the need for rented. But I was listening to your point. You do get, and you will get, shared ownership properties in blocks of flats. Now you'll find that the RPs would tend to prefer a block of shared ownership rather than having mixed, but there will be occasions, for instance, I can see it in the future, if we go higher up, you'll have mixed. So the service charge would be for the block. They would have the right to feed into it, but they wouldn't be the only ones paying service charges. You could have owner occupiers in there as well paying service charges.
Mariah?
Thank you, Chair. I just wanted to ask about the whole issue around stigma, because I know that there has been that point for shared ownership in terms of the fact that it reduces and I'm doing this because, to be honest, I don't have any knowledge of empirical evidence that supports that, but do you have that evidence base to say that shared ownership stabilizes land value or area value as opposed to having council houses mixed in or social houses mixed in with private? Thank you.
Julia may correct me. I would say it's anecdotal. We wouldn't have the evidence. It's supposed to be tenure blind when you're bringing forward affordable housing. But as you say, there is the view, there is the stigma. And again, I touched on it in my last point. You'll find whether it's more RPs than us because we're not bringing forward, they will tend to prefer to have shared ownership, kind of more from a management perspective as well. But we certainly won't have the evidence. It's anecdotal.
Does anybody else want to make any comments on this? Jenny?
Yeah. Two comments. I think you could have a look at the rateable values and the rating bands, and that would tell you that actually a lot of people do prefer areas that have got mixed shared ownership and council housing and so on, rather than solidly council housing. You know, the values go up. But the other thing I wanted to say is, yeah, there is a lot of ignorance among tenants about their rights about service charges. A lot of them don't understand, and the wording is obviously not crystal clear on the forms, that when the service provider, that when the housing association sends round their supposed consultation, they don't understand that it is a consultation about service charges. So they don't understand that they actually have a choice, and they can say, we want this looked at, we want to look at reducing, minimising what's done and so on. And that, it really is a surprise to them when we point that out. And they also don't necessarily understand that they can challenge the accounts and they can ask for details on what's been spent. So that I think it may be there's an education campaign about that, or pressure on the housing associations to educate their tenants better and word it more clearly might be extremely helpful. I've had so many inquiries in the last couple of years about, what's this service charge and how do I do it? And they just do not understand that they haven't got access to that information.
I wonder, I mean, these are good points, Jenny. I wonder whether we ought to, maybe when we look at our work programme later, decide whether or not to look at the wider issue of service charges and costs of housing. I mean, I think in terms of this debate, I'm not convinced that shared ownership is a significant option for people in the city. I'm much more of the view that we've got to get back to building more council and social housing. And that for me would be the priority. If I had 10 million in my pocket to put into housing services, it would not be on shared ownership. It would be on council housing or social housing. So I'm not sure that the debate on service charges is particularly relevant to this discussion tonight on shared ownership. But I think you're right about shared ownership. You're right about service charges, and maybe you might want to put it forward later on when we think about our work programme. Because it is a big issue, it's a horrendous issue in the private rented sector, even bigger issue. But anyway, in terms of tonight, can I suggest we note this report and thank the officers for the report? I think we're not convinced that shared ownership's the main vehicle. Oh, Jenny,
We can just leave
right.
that out.
Okay, I've been really keen tonight to write down people's names and tick them off, and I think keep butting in is not helpful, to be honest. Even if you're making some good points at times. I'm trying to just sum up where we are on this item. No, I'm not asking you at the moment. I'm putting something on the table, which is that we note the report, and I think we're noting that shared ownership is not the major vehicle in the city to meet housing needs. Is that a fair assessment? Right. Would you like to add anything to that? No. Okay. Right. That's item 6. Let's move on to the next item on the agenda, which is the work programme. It's going to be a verbal report.
So, Chair, just as a sort of discussion point, we wanted to leave a space on the agenda for the committee to discuss whether there are any items that they would like to propose for next year's draft work programme. Obviously, that remains a draft and subject to the agreement of the committee next municipal year, but we thought it may be helpful to give some suggestions as sort of a starting point for those committees when we get the other side of elections. So really just to open the floor if anyone has any suggestions for items that they'd like to put forward for next year.
Chair, we have in the planning group suggested quite a number of issues over the months, and I would suggest the request that the officer brings forward those issues for consideration next time, rather than trying to dredge up our memory and coming up with a random selection of them. But I think tonight we've added the service charge issue, haven't we?
That's interesting. Can I just ask Duncan or Jenny, because I just can't remember it. There's a recommendation in one of the motions tomorrow night that something should be referred to this committee. I think it's a Jane Carr recommendation. I'm not sure. I was just trying to see if I could find it. But I know it's one of the motions tomorrow night.
I assume it's going to be on the supporting home care workers.
I think it might well be.
Yes. So the motion asks that the Housing Health Adults Scrutiny Committee consider an item about how travel time and travel costs are treated within commissioned care home contracts and how providers demonstrate compliance with the council's commissioning standards. What I would say is, just so that we don't prejudge the outcome of the motion tomorrow night, obviously if the motion is carried, that would be put forward to the planning group. But yeah, I would recommend leaving that off at this stage so we don't prejudge what's going to happen at council.
I think that's really good advice, because I think when I was thinking about this earlier, I was thinking I shouldn't recommend it tonight, just in case the Labour Group whip says we're not supporting that motion tomorrow. But yeah, Tracy.
So no doubt it is already on your planning thing, but as the ICB, as we've got to the big and we've got the strategic commissioning, my recommendation would be to make sure that all of your parishes and all of the councillors here are really involved in the development of the neighbourhoods. So because with the ICB now we've got neighbourhoods, and that's the BLMK and the Central Beds, the Cambridgeshire and Peterborough and the Hertfordshire, but also within our neighbourhood, we've then got our health neighbourhoods, and the ICB is at the moment still trying to figure out, sort of, with the government still trying to figure out what to tell the ICBs to do to develop. But I think that there is going to be a real need for resident and because we've got the really unusual situation where we're a fully parished authority, I think we need to make sure that all of the parishes get really involved and understand how important it's going to be for their residents to be involved in building those neighbourhoods and making sure the neighbourhoods are what they want and not what the NHS want.
I think that's a really good thing. I mean, the Bletchley Pathfinder involving the two parish councils was, I think, quite effective in that. It was good engaging people. Just a different point. I think the new ICB structure is bonkers. You know, I mean, Cambridge, Peterborough, Outer Hebrides. You know, it's just a bonkers setup, and I think it's such a shame, because I thought the Milton Keynes, Luton, and Bedford ICB was working on a really good defined area that has some connectivity, but where we are with the ICB. Duncan.
Unfortunately, it's actually the Labour government that made these changes, and no one agrees with them. It's like these changes are being imposed on people without any consultation from the ground upwards. It's crazy. I agree. It's crazy.
And you say this Labour government? So in terms of this item, the work programme, you want to comment on the work programme again? Okay.
Well, I was going to suggest that for that item, the thing that I'm most concerned about is to look at the impact on services, because they keep talking about governance. People have already referred to the fact that they are pruning some of the service budgets. We need to be much more aware of that, because we're not getting any information from them at all about that. There was a reference to it in the minutes, but I think there's more information there that we could ask to see, perhaps, if it's possible, or to see a report.
I mean, I hate to be critical and pick you up, but didn't you, in your first contribution on this item, say we should pull together all the stuff through the chairs, the vice chairs and chairs officer meeting? And I thought we'd agreed that. So starting to add other items in just strikes me as a slightly.
This is about.
Okay. Right. I guess it must be really fun, Lib Dem group meetings. Right. So that's item 7. Item 8 is the 2 information items. It's the one on the CQC, which is really good news. But I think the point is Victoria wants to be here to do a full item on this at some point, because it is significant. I mean, I thought it was a really good result, and I must confess, I'm hoping that my contribution as from the scrutiny perspective helped, but I think that we've got a lot to shout is good on this, you know. And I think Victoria bringing another paper back, as I think is the game plan, isn't it? Is good. So tonight, I think we just note that it's a really good outcome from CQC. We look forward to a more detailed report on it. Are people happy with that? Right. Sorry, Tracy.
So, because I had to read through the full report as well as just the wee one, and I would just like to just, you know, blow our own trumpets. The independent organisation that is referred to is Health Watch. I don't know why the CQC couldn't mention our names. It was really weird. And and it bodes well for the Health Watch funding going to Budget Committee. Have we got time for me to just expand on that for a second? Yeah. So, because we're a statutory organisation, we can't be abolished until they get the health bill through. There are some murmurings among some of the lords, which surprises me. I don't think it'll make a difference, but because just before Christmas, the government said they weren't going to introduce any more legislation until the new financial year. So by the time the health bill goes through all its iterations, it's probably going to be April 27. That made it very tricky because this was also March was the last year of our grant funding. And so we've had to sort of talk to our commissioners about that. And they have put it through, it's gone to the delegated decision budget, because if we don't get the funding, that has to go to procurement, and that just seems a bit of a waste of time for something that's only going to be around for a year. So we're quietly confident, especially in the CQC report. It did mention that they were planning on doing some more stuff, and that's in our business plan. So we're hoping that means it's all going well.
Just to add on that, Chair, we did actually have that delegated decision earlier this evening, and the decision was taken. So that has been resolved.
Okay, so on this last item 8, we note the CQC summary and that the officers are bringing a more detailed paper back. And we also note the ICB report, and we perhaps also want to put in small print. We think what's proposed for the ICB is bonkers. Very small print, please. Okay. Can I thank everybody for attending tonight? I think we've actually had a couple of really good reports on the agenda tonight. And good luck to all those up for election in May. And hopefully see you in June. Thank you very much. And thank you to the officers.